Hi everyone, welcome to the webinar. Today we're going to discuss period hacks, 3 unconventional ways to say goodbye to period cramps. So just a little about me, my name is Delcy Morrison. I'm a family nurse practitioner in Rio Rancho, New Mexico. I have over 20 years of healthcare experience and I've worked in multiple different specialties, including family medicine, home health, maternal newborn, urgent care, emergency room, and nursing education. I am certified as a family nurse practitioner through the American Nurses Credentialing Center, or the ANCC. I'm also a certified health simulation educator by the Society for Simulation in Healthcare. I hold a certificate as a nutrition coach from the National Academy of Sports Medicine. I completed my functional medicine training through the Functional Medicine Academy and am certified as a Functional Medicine Academy certified practitioner. I became interested in functional medicine after seeing the impact that nutrition and lifestyle changes had on my own health issues. This is our disclaimer, just that the information provided in this webinar is for educational purposes only and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you have regarding your own personal medical condition. Okay, let's start with an overview of the menstrual cycle. So there's 4 phases of the menstrual cycle. First one is the menstrual phase, days 1 through 5. Then comes the follicular phase, which are days 1 through 13. Ovulation occurs around day 14, and the luteal phase, days 15 through 28. This is based on a 28-day cycle. Not every woman has a 28-day cycle, but this is the average, so this is what we're looking at here. So the menstrual phase, the first phase, is when the uterine lining or the endometrium is shed, resulting in menstrual bleeding. So this is when a woman has her period. The follicular phase is the first half of the menstrual cycle. It begins on the first day of bleeding, so it starts when the menstrual phase starts as well. During this phase, follicular stimulating hormone, or FSH, stimulates the growth of ovarian follicles, each containing an egg or an ovum. Then comes ovulation. Ovulation typically occurs around day 14 of the cycle. The mature follicle releases the egg into the fallopian tube in response to a surge in luteinizing hormone, or LH. Ovulation is the most fertile time in the cycle for conception, and conception is when a sperm fertilizes an egg and implants into the uterus, resulting in pregnancy. And then the last phase is the luteal phase. It begins after ovulation and lasts until the beginning of the next period, so the beginning of the menstrual phase. This is when the ruptured follicle transforms into the corpus luteum, a temporary cluster of cells which secretes progesterone. Progesterone prepares the uterine lining for a fertilized egg and maintains the pregnancy if it should occur. If pregnancy does not occur, then estrogen and progesterone levels decline, leading to the shedding of the uterine lining and a new menstrual cycle. The length of the menstrual cycle varies from person to person and depends on a variety of factors such as stress, hormonal contraception, and underlying health conditions. The key hormones in the menstrual cycle, which we mentioned a couple on the previous slide, but follicle stimulating hormone, or FSH, this stimulates the growth of the ovarian follicles. Luteinizing hormone, or LH, triggers ovulation and stimulates the development of the corpus luteum. Estrogen promotes the growth and thickening of the uterine lining. And progesterone maintains the uterine lining and prepares the body for pregnancy. So now let's talk about dysmenorrhea. What is dysmenorrhea? So dysmenorrhea means painful menstruation or uterine cramping, and there are 2 types. The first type is primary. This is caused by hormonal changes in the menstrual cycle. The second type is secondary, caused by an underlying medical condition. So for primary dysmenorrhea, it can range from mild to severe. It occurs when there is no underlying health condition causing the pain. It is caused by hormonal changes in the menstrual cycle. Prostaglandins are hormone-like substances that are released by the uterine lining that help the uterus to shed by causing uterus contractions. So women with higher levels of prostaglandins can have more painful periods. Changes in estrogen and progesterone during the menstrual cycle can cause an increase in the thickness of the uterine lining, causing it to be more painful to shed during menstruation. And then secondary, like we said, is caused by an underlying condition. Some of those conditions can be endometriosis, pelvic inflammatory disease, fibroids, or ovarian cysts. Secondary dysmenorrhea is also caused by prostaglandins, but can be worse due to an overproduction due to inflammation from the underlying disease. Estrogen also plays a role because some of the underlying conditions, such as fibroids and endometriosis, are estrogen dependent. Other hormonal imbalances, such as those associated with thyroid disease and polycystic ovarian syndrome, or PCOS, can also contribute to the pain. Lifestyle factors also come into play when talking about dysmenorrhea symptoms. Some of the lifestyle factors affecting dysmenorrhea include a poor diet, so a diet filled with highly processed foods, refined sugars, and unhealthy fats can contribute to inflammation and hormonal imbalances. Caffeine and alcohol use can cause dehydration and disrupt hormone levels, and we'll talk about caffeine a little bit more in the upcoming slides. Stress is the next lifestyle factor. So stress can cause high cortisol levels that can cause hormonal imbalances, inflammation, and increased muscle tension that can exacerbate period pain. A sedentary lifestyle. So regular exercise helps to decrease inflammation and improve blood flow. So people who are sedentary may have more severe dysmenorrhea symptoms. Smoking, nicotine, and other chemicals in cigarettes can constrict blood vessels and impair circulation, leading to increased cramping. Sleep disturbances. Adequate sleep is essential for hormone regulation. So if the hormones are off, that can make dysmenorrhea worse. Obesity. Adipose tissue produces hormones that can disrupt the menstrual cycle and contribute to inflammation. So being overweight and having that extra fatty tissue, that causes the body to have more circulating hormones, which can affect the severity of dysmenorrhea. Environmental toxins, so endocrine disrupting chemicals such as those found in plastics, pesticides, and certain household products can cause hormonal disruptions. And irregular menstrual cycle practices, so things such as poor hygiene, infrequent changing of sanitary products, and using products that contain harsh chemicals can cause irritation, infection, and increased pain. Diagnosis of dysmenorrhea using a functional medicine approach includes a detailed intake assessment. So a detailed assessment can help identify lifestyle factors that may be contributing to dysmenorrhea, as we talked about in the previous slide. Some labs that we may do, hormone panels can be used to look at the sex hormones and their metabolites to see if there are any imbalances. Inflammatory markers will be looked at. Elevated inflammation markers can identify inflammation that may be causing the dysmenorrhea. Nutrient and gut health testing. Vitamin D, zinc, magnesium, calcium, B vitamins, and omega-3 deficiencies can cause hormonal balances and increased inflammation that can lead to dysmenorrhea. So looking for those deficiencies is helpful. Food sensitivity testing. Food sensitivities can cause immune reactions that can lead to increased inflammation and increased dysmenorrhea. And finally, adrenal function test. Adrenal function tests help to assess cortisol levels throughout the day, which may indicate chronic stress. Chronic stress can impact hormone levels and exacerbate the symptoms of dysmenorrhea. Conventional treatment for dysmenorrhea includes nonsteroidal anti-inflammatory drugs, or NSAIDs. NSAIDs include ibuprofen, naproxen, and aspirin. They are considered first-line treatments for dysmenorrhea. They work by decreasing those prostaglandins, decreasing the production of those, and then thereby reducing pain. Hormonal contraceptives can also be used, oral contraceptives, the vaginal ring, the patch, etc. All of these help to regulate the menstrual cycle. They normally contain estrogen and progestin. They suppress ovulation and they decrease the thickness of the uterine lining and decrease prostaglandin production. And surgical procedures. This can be used to treat secondary dysmenorrhea and remove any fibroids or abnormal growths that are causing pain. Functional medicine treatment for dysmenorrhea focuses on treating the root cause, so nutritional support to fix deficiencies, eliminate foods that maybe the person's sensitive to, probiotics and fiber to fix gut health, and to help decrease inflammation and optimize hormone production. Hormonal support with supplements and bioidentical hormone therapy to help optimize hormone levels may be used. Lifestyle modifications such as stress reduction, sleep hygiene, and developing exercise programs. And finally, mind-body therapies such as acupuncture and mindfulness techniques, because those can help decrease stress and inflammation in the body, leading to decreased menstrual pain. So now let's talk about three things that you can start today to help decrease menstrual cramping. And so those three things are taking a mineral supplement daily, decreasing caffeine intake, and exercising. So let's look at mineral supplementation. A daily mineral supplement can help correct nutrient deficiencies, help with immune function, hormone regulation, and decrease inflammation. Specifically, magnesium helps regulate muscle contractions of the uterus. Calcium helps regulate smooth muscle activity, including the muscles of the uterus. Zinc is important for immune function, hormone regulation, and inflammatory symptoms. Iron deficiency anemia is characterized by low levels of iron in the blood and can exacerbate symptoms of dysmenorrhea. And potassium, which is important for fluid balance and muscle function, including the uterine muscle. So number 2, decrease caffeine. Caffeine may have an impact on hormones. So estrogen, high caffeine consumption has been associated with changes in estrogen metabolism. Caffeine may increase levels of estradiol, which is a form of estrogen, by interfering with its breakdown and elimination from the body. Adenosine receptors. Caffeine works by blocking adenosine receptors in the brain. This can stimulate the release of dopamine and adrenaline. Adenosine receptors are also found in the ovaries and reproductive tissues. So disruption of these receptors from caffeine can cause hormonal disruption and menstrual pain. And finally, cortisol. Caffeine triggers the release of cortisol, which can disrupt estrogen and progesterone levels. And our third thing is exercise. So exercise has many benefits for menstruating women. The first one is improved blood flow. Exercise helps to improve blood flow. Improved blood flow helps deliver oxygen and nutrients to the muscles, including the uterus, which can reduce cramping and pain. It creates increased endorphins. So exercise stimulates the release of endorphins, which are hormones that act as natural painkillers and mood boosters. Reduced inflammation. Regular exercise has anti-inflammatory effects on the body. By reducing inflammation, exercise may help alleviate menstrual pain caused by prostaglandin-mediated inflammation of the uterine muscle. Muscle relaxation. Certain types of exercise such as stretching, yoga, and Pilates can promote muscle relaxation and flexibility. This can help reduce muscle tension and alleviate menstrual cramps. Stress reduction. Exercise can help reduce stress levels and promote relaxation. Chronic stress can exacerbate dysmenorrhea symptoms, so managing stress through exercise may help improve overall menstrual health. And finally, weight management. Regular exercise can help people maintain a healthy weight, which is important for hormonal balance and overall menstrual health. Obesity is associated with increased dysmenorrhea symptoms. So in summary, dysmenorrhea can be improved with many lifestyle modifications. 3 things that you can do today to help your menstrual pain include taking a mineral supplement each day, decreasing your caffeine intake, and exercising daily. So we do have a special offer for those of you who attended the webinar. If you want to take a deep dive into your lifestyle to see how it impacts your hormone and menstrual cycle, then schedule a free consultation on our website, www.starryskyholistichealth.com, and mention this webinar and receive 30% off our Starry Pathway Functional Health Package. And any questions? All right, thank you for attending this webinar. We look forward to working with you.